Hello everyone, I am Dr. Nirmaljeet Singh Malhi, Senior Gastroenterologist and Liver Specialist and Chairman, Advanced Gastroenterology Institute AGI-The Gastrociti at Ludhiana. My purpose of this video is to give some important information about a disease called non-alcoholic fatty liver disease or NAFLD and its subtype called non-alcoholic steatohepatitis or NASH, which is fast emerging as an important cause of liver disease worldwide. I'll cover 5 important questions pertaining to this disease. First, what is NAFLD or NASH? NAFLD refers to buildup of extra fat within the liver cells. So this condition, when there is extra fat, we call it as steatosis or fatty liver. And when the patient consumes either no alcohol or very minimal amounts of alcohol, it's termed as non-alcoholic fatty liver disease. So early stages, there's only fatty liver, but as time advances, this fatty liver gives rise to inflammation or swelling of the liver with varying degree of liver damage in the form of scarring or fibrosis. So this condition, where there is an inflammation with or without fibrosis, is called NASH, non-alcoholic steatohepatitis, and this over a period of time give rise to what is called cirrhosis, where there is a permanent damage of liver, and then cirrhosis related complications leading on to liver failure, development of liver cancer, and high liver related mortality or death. Who are at risk of developing NAFLD or NASH? The most important cause is obesity or being overweight. And since obesity is the new pandemic and it has emerged as an important cause of different diseases pertaining to organ systems, when there is an extra weight in the body, there is storage of extra fat in different tissues, and liver is the one which bears that extra brunt because of increase in body weight. So obesity is the number one cause of rise in cases of fatty liver and fatty liver related complications like NASH and NASH cirrhosis. 2 is diabetes. Diabetes, as all of us know, India is fast emerging as the new diabetic capital of the world. And because of rising diabetes, rising obesity, we also are finding excess of fatty liver and non-alcoholic fatty liver disease and NASH in our own country. 3rd would be high blood pressure or hypertension. 4th would be dyslipidemia, where there is increased cholesterol or triglycerides. And lastly, the sedentary lifestyles along with high calorie food consumption in the form of processed or fast foods, frozen foods, and foods rich in fat or refined sugar content. What are the symptoms? In early stage, there are hardly any symptoms and people are asymptomatic and they're just picked up on incidental liver function test or ultrasound. As the disease advances and liver gets enlarged, there could be non-specific symptoms like right upper quadrant abdominal pain or discomfort or fatigue. And only in late stages, when cirrhosis sets in and complications in cirrhosis supervene, then we get symptoms like jaundice, development of edema over the feet, ascites, or there is alteration in sensorium called encephalopathy. But mind you, they all are late symptoms and by that time sufficient liver damage has occurred. How to diagnose NAFLD or NASH? It is with the help of a simple blood test, which are told as LFT, or even an important test called complete blood counts, where there could be reduction in the platelet count. So low platelet count is an important marker of underlying liver disease. Ultrasound is able to tell us about the fatty liver presence or not, and whether there is a cirrhosis set in already in this patient or not, also we come to know through ultrasound. But the most specific test I would say is a fibroscan, which is able to quantify on one hand the amount of fat in the liver and on the other hand the degree of scarring or fibrosis in the liver. Lastly, what are the treatment modalities for NAFLD or NASH? Since I told in my talk, this is more of a lifestyle disorder than a disease. It's a mismatch or imbalance between the intake of calories versus the calories expenditure that the body is able to do. So it's an inflow, outflow or an input-output imbalance. So treatment will also be centered around on one side reducing the calorie intake and on the other side improving the calorie expenditure. So we have to make dietary amendments which include reduction in the calorie intake by reducing the processed or the fast foods, or reducing your refined sugar or the fat content, and reducing the portion size of the meals also, so that you take less calories and you take food which is already low in calories, like high fiber foods, vegetables, whole grain cereals, fruits. Second part would stay out to be the lifestyle modification, more proactive life, where you're able to spend calories 30 to 45 minutes of aerobic activity a day, at least 5 days in a week, in the form of brisk walking, jogging, cycling, so on and so forth. The role of drugs is very limited, and that too in late stages, and that is in the form of in those people especially who have fatty liver with varying degree of fibrosis. And two drugs which are available to us, one is saroglitazar and other is obeticholic acid or OCA, but they have to be taken with a specialist advice, especially a gastroenterologist or an expert physician or a liver specialist. So my dear viewers, I like to sum up that non-alcoholic fatty liver disease and NASH are fast emerging as an important cause of liver disease and liver-related death worldwide. The common reason behind this is the increase in obesity and diabetes worldwide. Symptoms in initial stages are none, but when the symptoms come, it's already too late. Diagnosis is with the help of simple blood tests, ultrasound and FibroScan. The treatment is basically aimed at optimization of your body weight by reducing calories and increasing your physical activity. I hope with this video I have been able to take care of many queries and few of the questions which most of the people pose to us regarding NAFLD and NASH. Thank you so very much.